different types of joints. So category of joint, types of type and description, category of joints, main category of joint, types of joint and their description and examples. Okay, because I am taking this third time because this is very important. तो इसके ऊपर क्वेश्चन आ सकता है कंफ्यूज करने के लिए आपको कैसे भी क्वेश्चन पूछेंगे जैसे एक कॉलम में देंगे वन ऑफ द फॉलोइंग इज नॉट अ मूवेबल जॉइंट ऐसा बोलेंगे आप मतलब ये कैसा भी क्वेश्चन पूछ सकते हैं मैच द फॉलोइंग या फिर डायरेक्ट क्वेश्चन सो फर्स्ट कैटेगरी immovable joint so there is no movement in the joints immovable joint they are also known as a synarthrosis 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 means immovable joint so for example in case of sutures or a joint present in the skull that is a immobile type so example is nothing but they are present in the cranial bones other joint present in the cranial bones and facial bone. Then second one is known as a slightly movable joint. Amphiarthrosis. 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 So for example, subtype is symphysis. Disc of fibrous cartilage between the bones. So there is a slight movement. So this is type of bone is present in the vertebra between the vertebra and between the pubis bones. Pubic bones. So third category of bones, third category of joints is nothing but the freely movable joints. They are also known as diarthrosis. 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 So in that you have different examples. For example, this ball and socket joint. Ball and socket joint. So movement in all plane is possible. So this is present in the scapula and humerus of and in case of pelvis also humor and pelvic joint. Then next one is nothing but the ball and socket joint. Next one is a hinge joint. So movement in one plane only. That is a joint present between humerus and ulna, femur and tibia between phalanges also. And third type is known as a condyloid joint. So movement in one plane only. Some lateral movement is also there. Temporal bone and mandible. This type of joint is present in the temporal bone and mandible. Okay. Next one is known as a pivot joint. So there is a rotation. For example, atlas. So whatever joint is present. So atlas and spine. That is a pivot type of joint. And saddle joint. Movement in the several plane. Carpals and metacarpals. Thumb joint. That is a saddle joint. And next one is known as the gliding joint. Side by side movement is there present between the carpals. So this was again a types of joints. This I have taken 3 times because this is important. इसके ऊपर क्वेश्चन आ सकता है आप इसके वजह से 3 बार लिए नेक्स्ट वन इज डिसीजेस ऑफ बोन्स इसके ऊपर भी क्वेश्चन आ चुका है so just have a quick review of it disease of bones so first disease is nothing but the osteoporosis means decrease in the bone density okay decrease in the bone density so reduced bone density because of the reduced deposition of minerals on the bones or increased reabsorption of minerals from the bones minerals particularly calcium so reduced bone density because of the reduced deposition of and increased reabsorption of calcium. Though the bone is normally mineralized adequately, but still it is a fragile and microscopically the normal structural loss is there. Normal internal structural loss. That is the osteoporosis. Osteoporosis मतलब bone density कम होना, bone tissue होने. Okay, easily the bone the person suffering from osteoporosis the bones of that person is easily broken down. A common feature of such osteoporosis is nothing but the common feature includes skeletal deformity, bone pain, fractures, especially of hip and wrist joint and vertebrae. Frequently fractures होंगे इसको अगर जिसको भी osteoporosis हो गया उसको fractures जल्दी हो जाते हैं. Then next one is a Puget disease. Puget's disease is the disorder of bone remodeling imbalance between normal bone building and breakdown. Puget disease because of the imbalance between bone remodeling means imbalance between bone building and bone breakdown. So there is increased bone breakdown than bone formation. So in case of Puget disease. So bone deposit is a soft and abnormal in this case. Most of the cases most of the cases structure that occurs after 40 years of age. Most commonly in the pelvis, skull, and this tibia femur. So also increases the risk of osteoporosis. Bone density is decreased after 30 years in both genders. Normally क्या होता है 35 years के बाद में bone density आपका कम होने लगता है. Lower estrogen levels in the females after the menopause are also associated with the period of accelerated bone loss in the woman. ठीक है 35 के बाद में उनको कैल्शियम का टैबलेट चालू करना देन रिकेट्स एंड ओस्टियोमलेसिया so in the both condition bone adequately mineralized and usually because of the vitamin D deficiency so in this case rickets and osteomalacia it means there is inadequate insufficient mineralization of bone में calcification क्या होगा insufficient कम होगा rickets and osteomalacia now rickets occurs in the children's and osteomalacia occurs in the adults adult में osteomalacia होगा rickets होगा children's में and that is due to deficiency of vitamin D deficiency or sometimes because of the defective vitamin D metabolism okay so remember here rickets that occurs in the children osteomalacia that occurs in the so इसके ऊपर क्वेश्चन आ चुका है vitamin D deficiency in the children's will cause one of the following that is the rickets osteomalacia and all that so rickets is caused in the children's osteomalacia is caused in the adults these there are certain other diseases also see that osteomyelitis commonly it is seen in the children because of the bacterial infection of bone and may follow an open fracture or surgical तो इसमें bone का infection जब होता है तो उसको बोलते हैं osteomyelitis development of abnormal bone ठीक है development of abnormal bone next one is the development of abnormal bone osteomyelitis मतलब infection of bone commonly in the children due to bacterial infection next one is nothing but the developmental abnormality of bone so during the development of child so उसमें क्या achondroplasia is a genetic abnormality which in which there is no proper ossification of bone there is no proper ossification of bone that develops from cartilage for example in case of long bones so achondroplasia means improper ossification of bones then osteogenesis imperfecta there is another problem known as osteogenesis it is also known as a brittle bone syndrome so there is a congenital defect in the collagen synthesis resulting into failure of ossification the bones are brittle and fracture easily either spontaneously or by offering a very slight trauma. Brittle bone disease जिसको है मतलब वो brittle bone disease को है मतलब उसका हाथ नीचे गिर भी गया तो उसका फ्रैक्चर हो जाए इतना मतलब ये होता है congenital genetic disease होता है genetic disease brittle bone syndrome और osteogenesis imperfecta then bone tumors तो इसमें दो तीन टाइप के ट्यूमर होते हैं benign tumors और bone cancer bone tumors और bone cancer benign tumor metastatic tumor and primary तो benign tumor single or multiple tumors develop or unknown reason for unknown reason in the bone तो कुछ किसकी वजह से हुआ है bone cancer मालूम नहीं that is known as a benign tumor single or multiple tumors metastatic tumor means most common type of malignancy of the bone this is primary carcinoma